Bloating is common, but it's not always harmless. The tricky part is that normal bloating has patterns, and concerning bloating breaks those patterns. If your belly swelling is new, intense, or changing fast, that's your cue to pay attention. A little fullness after a big meal is one thing. Bloating that shows up most days, or comes with other symptoms, is different. The goal here isn't to panic. It's to help you recognize when it's smart to get checked, so you don't miss something important. You'll hear about specific red flags, what they can point to, and what information helps a clinician evaluate you faster. You'll also learn how to track your symptoms in a simple way, without turning your life into a spreadsheet. By the end, you should feel clearer about what's likely benign, and what deserves a timely appointment. Let's start with the biggest question: what changed? Moving to slide 2. First, let's define what many clinicians consider typical bloating. It often follows meals, especially large, salty, or high-carb meals. It tends to build through the day and improve overnight. It's usually mild to moderate, and you can still function. It also responds to simple factors like eating slower, reducing carbonated drinks, or having a bowel movement. Another common pattern is hormone-related bloating, which can come and go with the menstrual cycle. What's less typical is bloating that is severe, persistent, or progressively worsening. Also less typical is bloating that appears without any clear link to food, stress, or bowel habits. Think of normal as predictable and reversible. Think of needs checking as new, escalating, or paired with warning signs. With that baseline in mind, the first red flag is a sudden change from your usual pattern. Moving to slide 3. A big warning sign is bloating that's new for you and doesn't settle down. If you rarely dealt with it before, and now it's happening most days for 2 to 3 weeks, that's worth discussing with a clinician. The reason is simple. New symptoms can signal a new trigger, like a gut infection, a medication side effect, constipation, or food intolerance. But they can also be the first clue of something that needs evaluation, like inflammatory bowel disease, celiac disease, or a gynecologic issue. Pay attention to the timeline. Did it start after travel, a stomach bug, antibiotics, or a major stress period? Did you change supplements, protein powders, or sugar alcohols? New doesn't automatically mean serious. It means your body's pattern changed, and it's reasonable to ask why, especially if it's persistent. Moving to slide 4. Next red flag: bloating that keeps getting worse over time. Progressive bloating can mean your gut is moving slower, you're retaining fluid, or something is physically taking up space. Sometimes it's constipation gradually building. Sometimes it's a motility issue, where the intestines don't push things along efficiently. In other cases, progressive abdominal distension can be related to liver, heart, or kidney problems that cause fluid accumulation. And in a smaller number of cases, it can be linked to masses in the abdomen or pelvis. What matters is the trend. If you notice your waistband getting tighter week by week, or your abdomen looks more distended even when you haven't eaten much, don't just keep switching diets. Track the progression and get evaluated. Progressive symptoms are one of the clearest reasons to seek medical input. Moving to slide 5. Pain changes the story. Mild pressure is common with gas, but significant pain with bloating is a warning sign, especially if it's sharp, constant, or wakes you up. Severe pain with a hard, distended abdomen can suggest an urgent problem, like bowel obstruction, appendicitis, gallbladder inflammation, or other acute abdominal conditions. Another concern is pain paired with inability to pass gas or stool, because that combination can indicate a blockage. Also pay attention to pain location. Right upper abdominal pain after fatty meals can point toward gallbladder issues. Lower abdominal or pelvic pain can overlap with gynecologic causes. If bloating is painful enough that you're changing how you walk, breathe, or sleep, that's not something to push through. It's a reason to get checked promptly. Moving to slide 6. Unintended weight loss with bloating is another red flag. This is different from losing weight because you changed your diet or activity on purpose. If you're eating about the same, but the scale is dropping, that deserves attention. Possible explanations include malabsorption, where your intestines aren't absorbing nutrients well. Celiac disease is one example. Chronic inflammation, thyroid problems, and certain infections can also contribute. In some cases, weight loss can occur because eating becomes uncomfortable, so you naturally eat less. The key is the combination. Bloating plus weight loss suggests your body isn't processing food normally, or your overall health is being affected. A clinician may ask about appetite, stool changes, and how fast the weight loss happened. If you notice your clothes getting looser while your abdomen feels more distended, that mismatch is worth checking. Moving to slide 7. Blood changes the urgency. If you see blood in your stool, black tarry stools, or persistent rectal bleeding, don't assume it's just hemorrhoids, especially if bloating is also present. Bright red blood can come from hemorrhoids or fissures, but it can also come from inflammation or other causes. Black, sticky stools can indicate bleeding higher up in the digestive tract. Another clue is iron deficiency anemia, which can show up as fatigue, shortness of breath, or pale skin, and sometimes is discovered on routine labs. Bloating paired with bleeding, anemia, or a strong family history of colon cancer should be evaluated. This doesn't mean it's cancer. It means the symptom combination deserves a clear explanation. The sooner you bring it up, the easier it is to sort out the cause. Moving to slide 8. Let's talk about bowel habit changes because they're easy to dismiss. If bloating comes with new constipation, new diarrhea, or an alternating pattern that lasts more than a couple of weeks, it's worth evaluation. Many people think constipation only means not going, but it can also mean straining, hard stools, incomplete emptying, or needing laxatives more often. Diarrhea that's frequent, urgent, or happens at night is more concerning than occasional loose stools. Another red flag is a noticeable change in stool caliber, like persistently thinner stools, especially with other symptoms. Conditions like IBS can cause bloating and bowel changes, but IBS is a diagnosis made after ruling out other issues, not a label you give yourself. When the pattern is new or escalating, get checked. Moving to slide 9. Fever, chills, or persistent nausea and vomiting with bloating are signals to take seriously. A mild stomach bug can cause temporary bloating, but it should improve as the infection resolves. If you have bloating with ongoing vomiting, you can become dehydrated quickly, and it may indicate obstruction, severe inflammation, or another acute condition. Persistent nausea can also point to delayed stomach emptying, sometimes called gastroparesis, which can be associated with diabetes, certain medications, or other medical issues. Another clue is vomiting that looks like coffee grounds, which can indicate bleeding and needs urgent evaluation. The main idea is this: systemic symptoms, like fever or inability to keep fluids down, shift bloating from annoying to needs medical attention. Trust that signal and seek care promptly. Moving to slide 10. Bloating can also come from outside the intestines. For women and people with ovaries, persistent bloating with pelvic pressure, feeling full quickly, or urinary frequency should be taken seriously. These symptoms can overlap with benign issues like fibroids, ovarian cysts, or endometriosis. But persistent, progressive bloating is also one of the symptoms clinicians watch for in ovarian cancer screening discussions, especially when it's new and frequent. The key word is persistent. If you feel full after a few bites, or you're peeing more because of pressure, and it's happening most days for several weeks, don't just assume it's food. Track it and bring it up. For men and people without ovaries, pelvic or lower abdominal pressure with urinary changes can still suggest bladder or prostate issues. The takeaway is to consider the pelvis, not only the gut. Moving to slide 11. Another overlooked factor is medication and supplement effects. Common culprits include iron supplements, certain pain relievers, some antidepressants, and medications that slow gut motility. Metformin can cause gas and diarrhea in some people. GLP-1 medications can cause nausea, fullness, and constipation, especially during dose changes. Even natural supplements can contribute. Magnesium can loosen stools, while high-dose calcium can constipate. Sugar alcohols like sorbitol and xylitol, often found in gum and keto snacks, can cause significant gas and bloating. The warning sign here is timing. If bloating started soon after a new pill, dose increase, or new supplement routine, that's valuable information for your clinician. Don't stop prescribed medications on your own, but do bring the timeline and details to your appointment. Moving to slide 12. So what happens when you do get checked? A good evaluation is usually straightforward. You'll be asked about onset, triggers, stool pattern, pain, weight change, and family history. A clinician may do a physical exam, including checking for tenderness, masses, or fluid. Depending on your symptoms, basic labs may include a blood count for anemia or infection, inflammatory markers, thyroid testing, and sometimes celiac screening. Stool tests can help if diarrhea is prominent. Imaging, like an ultrasound or CT scan, may be considered if there's progressive distension, significant pain, or concern for a structural issue. For some people, endoscopy or colonoscopy is the right next step, especially with bleeding, anemia, or strong risk factors. The point is not to fear the workup. It's to match the tests to the red flags. Moving to slide 13. Before your appointment, you can make the visit more productive with a simple symptom log. Keep it short. Note when bloating starts, how long it lasts, and whether it improves overnight. Track stool frequency and consistency, using plain descriptions like hard, normal, loose, or watery. Write down any associated symptoms: pain level, nausea, fever, bleeding, early fullness, or urinary changes. Also list recent changes: travel, illness, antibiotics, new medications, and major diet shifts like high-protein bars or more dairy. If certain foods seem linked, don't over-restrict. Just note the pattern. This kind of information helps your clinician decide whether this looks like constipation, IBS, intolerance, infection, inflammation, or something outside the gut. And it reduces the chance you'll leave with, "Let's wait and see," when you actually needed a clearer plan. Moving to slide 14. Let's wrap this up with a practical decision rule. If bloating is mild, predictable, and clearly linked to meals or your cycle, it's often reasonable to monitor and adjust habits. But if it's new and persistent, progressively worsening, or paired with red flags, significant pain, vomiting, fever, bleeding, anemia symptoms, unintended weight loss, or major bowel changes, get checked. And if you have severe pain, a hard distended abdomen, or you can't keep fluids down, that can be urgent. You're not being dramatic by asking for an evaluation. You're being precise about your health. If you want more videos like this, subscribe. And for a quick check-in, comment yes or no. Have you ever ignored bloating for more than a month before getting it evaluated? This information is not a substitute for medical advice.